And Charlie, is there things that people can do within the home environment that can actually make this a little bit easier for both person they're supporting and caregiver?
Yes, absolutely. And a little bit like trying to get that message through that fog that's there is making the visual things more clearly visual. So perhaps leaving the toilet door open so that somebody knows that there's a toilet there, or actually having a photograph of the toilet on the outside of the toilet door so that they can see where it is. The other thing is actually in the toilet, instead of just having the white toilet seat on the white toilet, actually having something that stands out. So having a black toilet seat or a coloured toilet seat, so that they can actually pinpoint where things are.
Right, good afternoon, everybody, and thank you so much for joining us on today's Dementia Adventure Facebook Live session. We're so glad you could join us. My name's Ruth, and I work for our Dementia Support Services. Now, today we're going to be talking about a topic that can often feel quite sensitive for many carers and family members, and we're going to be looking at continence and incontinence in dementia, and why that matters for wellbeing, dignity, and the confidence of both us as carers, but also for those that we support. It is completely normal for this to feel like a tricky subject, and that's why we want to provide a safe, supported space to explore it. So in this next half an hour, I'm going to be talking with Charlie and Nina, who bring their expertise to this area. So I will let them introduce themselves. Nina, tell us a little bit about yourself and what you do.
Hi, my name is Nina. I know Dementia Adventure for quite a few years already. I am a holiday supporter, and I think I was thinking about earlier. I think I've been to 4 holidays, and this year it's gonna be my fifth one, and I'm super excited. It's gonna be really, really good. And yeah, I'm a nurse. Currently working for 2 years already as an Admiral Nurse, dementia specialist nurse in London, Southwark. That's me. Very excited
So
to be
you are
here.
bringing that day-to-day lived experience. You are seeing this topic on a daily basis, aren't you? And supporting carers with that.
I do, I
So that's
do.
fun.
Exactly.
That's
And it's
amazing.
very, very normal to just reassure everyone. It's very normal.
Definitely. And we've got Charlie with us as well. Charlie, give us an introduction.
Hello, yes, I'm Charlie. I've been a full-time GP for 32 years, recently retired. And my connection with Dementia Adventure was my brother-in-law had early onset Alzheimer's disease, and he went on a Dementia Adventure trip with my sister, and it was amazing to see the difference how he was when he came back from how he was when he went. Absolutely fantastic, and I therefore looked into it when I retired, and I've been a Dementia Adventure support volunteer for the last 2 years. So I'm really delighted to be here because it's a really interesting topic, and it needs to be talked about and explained and
That's
destigmatized.
brilliant. Thank you, Charlie. So, as you can see, we are incredibly lucky at Dementia Adventure to have an amazing team of volunteers, but who also bring us a wealth of knowledge, particularly around these more challenging subjects. Just before we get started, there's a little bit of housekeeping. So, please do pop any questions that you have in the chat. We will do our best to answer those. Before we go any further, I am going to caveat that we will not be able to answer medical questions, and we would always advise seeking advice and support from your GP or a medical practitioner. We will provide links to the Admiral Nurse service if you would like to speak with them afterwards. So, as always, I'd also like to give a quick shout out to Right at Home, who sponsor our Unpacking Dementia series. But I think let's jump right in. So, let's start by trying to understand a little bit about what continence can look like and start with the basics, because I think actually incontinence really is quite common for people living with dementia. But it's not just about forgetting or not trying hard enough, is it? And Charlie, could you explain why this might happen?
Yes, indeed. When I started way back as a medical student, we used to learn about a thing called the call to toilet. It sounds quite sort of formal, but actually, what is the call to toilet? It's that sensation you get, need to go. And what happens is, as the bladder fills up or the bowel fills up, the muscle walls get a little bit stretched. That sends a message to your brain, and you're standing there having a conversation in Sainsbury's, and you think, oh, could do with going to the toilet. But you don't have to say anything. You know that, oh, I'm going to be fine for half an hour, or oh, I need to get to the loo. I'm going to have to finish this conversation and go. And you understand that completely normally without any problems. The problem is when you have the cognitive problems with memory, that those pathways become very foggy. And although you know that there's something there, you can't see it. You don't feel it as well. So you've got this fogginess around the call to toilet. And then it can be made more difficult because actually, because you've got that fogginess, you don't quite know where the toilet is, especially if you're in Sainsbury's or somewhere. So you don't know where to go. Or you go to the toilet, but there's a mirror there and you see your reflection, but you think it may be somebody in the toilet. So that's another problem with this sort of fogginess. And so that's why you don't get there in time and an accident happens. And then to complicate it even more, there may even be underlying sort of medical problems like water infections, constipation, medication that you're taking, various things that make that even worse. So that's what's happening. Incontinence is the call to toilet that is covered and shrouded in fog that just doesn't quite get through. So how can you actually get that fog out of the way and get it better?
So I think it'd be fair to say, like with a lot of subject matters within the dementia field, that actually it's about that message getting through to the brain. And, sometimes those messages aren't getting through, or they're getting delayed, or they're not being recognized. So it's actually, when we think about it like that, it's not a huge surprise, is it? Because everything is derived from those messages. Our body, tells our brain what we need to do and respond to that accordingly. Nina, what are some of the signs that carers might see just prior to an accident happening? Is there some like signs that carers might be able to look out for?
It is, and that actually, yes, and it does go in line with what Charlie has said and you as well. For example, like when you are at Sainsbury's with your loved one, like, and you notice, like, restlessness, like, pacing around and maybe like looking a little bit like, even like confused. Because then again, like,
Mm.
it's like, with that information, what, there's that feeling in your body, but you don't really know what does that actually, what's that supposed to mean. And or like if you are like together like in the living room, repeatedly like standing up and down from the chair, or trying to like I'm just thinking, like if your loved one does not know straight away like where might be the bathroom, like if like
Mm.
the trip actually ends in the in the bedroom, like going there, or also like randomly like opening cupboards, looking for like maybe the loo, like that complete confusion and
There's that
increase.
confusion and that agitation
Yeah,
levels might increase. Yeah, yeah, yeah,
exactly. Yeah,
absolutely.
and
So,
also, oh, so, sorry. Yeah, like also like
no, go on.
sometimes like fiddling around, like with the trousers, like with a belt, or if someone wears pull-ups, for example, like sometimes even, which is very normal, like putting even the hand inside of the pull-up, and like that fiddling as well. Sorry.
Yeah. Yeah, yeah, yeah. No, but I think the reassuring message here is that incontinence is not necessarily inevitable. In fact, there's many things that may be manageable or treatable that we can support with this. So, it is absolutely worth having those conversations. But also there is signs that we can start to look out for to maybe prevent an accident, or just encourage somebody to go to the toilet. They may want to use the toilet, because I guess the encouragement to go and not need it is possibly going to be better to deal with than actually maybe if we kind of not necessarily respond to those signals. So again, really that brings me on to that next question about, is there things that carers can do in daily life to support that continence? Like thinking about routines, is there, specific things that could be really helpful to support managing this if it becomes more challenging? Nina.
It definitely, like especially during daytime, like prompting your loved one, like maybe depending, of course, if you have seen how much input your loved one has, like every 2 to 4 hours, prompting to go to the toilet, and maybe also not just like saying, asking, do you need to use the loo, but just like literally actually taking your loved one to the toilet and see. And also what I suggest, or like could suggest, is if you try to give loved one like the majority of the fluids of the drinks for its bedtime. So because then obviously everything will need to come out at some point, and that is how like accidents can happen. And also, for example, like just gentle prompting, like after, for example, having a meal, after dinner, after lunch, and definitely before bedtime. And also what is helpful, like what what even I do before I go out, like, before any trips, just going to the bathroom, like,
Yeah.
that would be
And would
great.
it be fair to say keeping this routine quite predictable and quite calm? I think that can absolutely
Exactly.
be key. It's our approach to that. I think it's quite easy to get in the realms of that worry and that anxiety about somebody maybe having an accident or needing to go. And certainly our approach as a caregiver can be really helpful to keep that calm, maybe model that behavior, like, oh, we're going to go out. I need the loo. Actually, do you want to go as well? Just keeping it not about the problem, but more about, the approach to the problem. Would that be fair?
Exactly.
Definitely. But
Mm.
what we certainly wouldn't recommend is dehydrating somebody. So not giving somebody drinks. Like you were saying about sort of keeping rehydrated during that night, but having an awareness that maybe in the evening time, that's the time where we would drink less or certainly be more aware of that fluid intake. Is that fair?
Exactly. Like never stop like offering someone drinks, but just like the majority of the fluids during daytime, and then just like for the nighttime, like have that glass of water, of course, always next to the person.
Yeah. And Charlie, is there things that people can do within the home environment that can actually make this a little bit easier for both person they're supporting and caregiver?
Yes, absolutely. And a little bit like trying to get that message through that fog that's there is making the visual things more clearly visual. So perhaps leaving the toilet door open so that somebody knows that there's a toilet there, or actually having a photograph of the toilet on the outside of the toilet door so that they can see where it is. The other thing is actually in the toilet, instead of just having the white toilet seat on the white toilet, actually having a something that stands out. So having a black toilet seat or a coloured toilet seat, so that they can actually pinpoint where things are. Also making the path to the toilet easy. So not having things on the landing that a chair or something that might bump into or
Mm.
distract them there somewhere, and having lighting, good lighting, especially at night. The question of nighttime is very difficult, but actually having this sort of the motion censored lighting that just comes on when somebody's moving can be really helpful as well. So those are probably the sort of some of the main things that you can do. Um, and also the business about not having reducing the fluid intake just a couple of hours beforehand. But it's so important not to be dehydrated, because constipation is a major problem with the incontinence problems, because the constipation blocks the passageway out from the bladder. So it can be really difficult.
Yeah, it's a really challenging one to manage, isn't it? And I think actually the real takeaway there is about providing that contrast. I think bathrooms are often very neutral colours. They're often designed to look very lovely, and that's nice. But actually, for people living with dementia, it is that colour contrast that makes all the difference. I know for those of you who've joined us, if there is areas of interest about what that looks like and where you can buy products, places like the Alzheimer's shop absolutely have recommendations, and you can get a really good idea of things that are available on there. Equally, we will provide you with some resources to look at around that. But and again, like that lighting at night time, so having those sensor lights, you don't necessarily need a plug socket for those. You can get some that are motion centered, and that can be game changing, can't it, for somebody to be able just to navigate their way through to a bathroom. And in fact, I think we've seen a comment in the chat that actually somebody needed to just change the colouring around their bathroom to be able to support their father with that. So that's really, really helpful. Nina, what about clothing? So when we think about things during the day, I think clothing's really important, isn't it? Because it plays in a lot to our identity. And, keeping that sense of identity, which we know is so important for people living with dementia. But actually, when we're talking about belt buckles, when we're talking about zips and buttons, can that create an issue? Is there things we can do around that?
It certainly can, like like you said, like it's super important that the individual actually stays like how they are and what they wish to wear, and but also like if possible, like instead of like loads of like buttons on the trousers, or like very complicated belts where you have to really fiddle around, like trousers like with just like that elastic kind of like band that you can easily pull down if it has to be quick, and also like,
Mm,
yeah, don't have that fiddling around, or it could also be like they're like, some of us ladies, we love to wear tights, right? And that can get very, very difficult to get quickly
Yeah.
down, like, and then maybe if possible, still that they fit, but maybe not too tight, the tights, maybe just like a size bigger, just to see that it works. It's always about, like, see the way that it works, and someone still feels like themselves and super, super comfortable, but basically
Yeah.
so that
And I
it's
think
in and out.
And I think as well, what could be really helpful is certainly when we run trips, and I know you guys will know from the support that you've provided on our holidays, we always have like just a spare pair of joggers with us. Accidents do happen. It's not the end of the world. Ultimately, what we want to do is keep somebody's dignity. So, having that spare pair of joggers can make all the difference. But I think you're right. It's really important that actually I wouldn't want to be in joggers all day long. But equally, I think it's thinking about, can we buy maybe a pair of jeans with an elasticated waist, or skirts, if you're a lady and would like to wear a skirt. It's about thinking about those practicalities, isn't it? Which sometimes it's easy to miss. This doesn't come with a label, as we all know. So it's really, really about that, accepting that accidents can happen, but actually there are things we can do to support that, and how we respond as a caregiver is really, really important. Charlie, what would your main advice be to caregivers when they find themselves in that position, and you're out somewhere, that accident has happened? What can we do to ensure that actually we can move on from this?
Yeah, absolutely. Well, sort of the concept of accidents and things, I think with incontinence, incontinence is actually a symptom of the illness. If you imagine somebody had gastroenteritis or something like that, and they vomited, they're sick, you feel for them. It's an unpleasant thing being sick. You have to clear it up. The person usually feels pretty awful about it. And you try and encourage them and reassure them that it's okay. And in a way, that's the symptom of the bowel problem. That's the symptom of a gastroenteritis, for instance. And incontinence is a symptom of what we're dealing with here, because of the brain fog that we've got, because of the not being aware of where you are. It's not something that they're doing on purpose. It's something that it is a symptom of the condition. So actually trying to look at it as a symptom, as you would any other kind of symptom of an illness. That's one way of sort of normalizing it and saying, I want to help you through this, rather than getting angry about it. Of course, it's frustrating. Of course, especially in the night, if you've been up once, twice, three times, you get sleep deprived. That's where the sort of the pressure builds up. But it's not something that the person is doing on purpose. They wouldn't want to be doing it at all. It's
Mm.
actually trying to accept that this is a symptom. And as you would if you had a symptom of recurrent vomiting, you would go and you would seek advice for it. You'd seek help. And that's exactly what you should go and do. You should go and talk to your GP, talk to the clinicians, talk to the Admiral nurses, because it's a symptom of the illness that is causing a really negative effect on the quality of life. And it's the same as any other medical symptom. So that's how I would address it. And you want to sort of get alongside the person, normalize it, try and reduce down the anxiety, and say, well, it's happened, but we can put another pair of joggers on. And hopefully, with that extra support, going to ask for help, as you would with recurrent vomiting, for instance, you will get really good support in ways in which we can overcome some of these problems. So I think that's the way to try and address it, really.
So I think it's about, isn't it? It's taking that deep breath, isn't it? And understanding, and certainly, we've all sat here in that caregiver form as well, that actually it is sometimes really hard to do that, but avoiding that blame and normalizing this as an experience to provide that dignity and that support can be absolutely key. But, like Charlie said, do reach out for help, because it is a symptom of, and actually there are continence clinics. GPs are very well versed in understanding and having these conversations, as I know the Admiral nurses are. So I think really that moves us on to products to support this. Are there things out there that people can buy before maybe reaching out, if you're not quite comfortable to have that conversation yet? Nina, what do you talk to carers about? Is there particular products, sort of pads, mattress covers, etc., that can be helpful?
Definitely, like, I would definitely recommend mattress protectors, mattress covers, like, the ones that you can then like, wash yourself, but also the incontinence pads, those square
Yeah.
ones. that you can then just like, if an accident has happened, just like throw out, or giving it like before you would reach out to a medical professional or reach out to the continence clinic to get an assessment, and then the incontinence products, maybe just try go to Boots anywhere, like, try to get a pair of like Tina or like any other brand, just like, to see like, if the pulls up
Yeah.
are actually well tolerated. So like
And I
that
think
would
I'm
be
just
good.
picking up from the chat that actually some people are saying the pads that they've been provided with aren't particularly great. People go through them. Is it a bit of a trial and error sometimes? Is it, you just kind of have to find what works for you?
It is definitely. And from what because if you go yourself, like, to the chemist and buy them, you can only go and think like, oh, maybe I need S, maybe M, L. But then it might be actually worth, if you cannot find the right size for you or your loved one, actually reaching out to the continence team, because then someone will come do the assessment, which means someone will take your measurements, so that
Right.
actually, like, that you 100% know it is SM, and
Yeah.
that it does fit, like,
Yeah.
because
Yeah,
it is really
definitely.
tricky. Yeah. And
So it's
also,
really about finding what works for you. And, it might be a little
mm,
bit of trial and error, but actually that's okay. And, we can work with that.
it is definitely, and it just pops in my mind because, like, I mean, we all have different bodies, and sometimes, like, an S or as an M might not fit you. So, like, what I'll recommend to people that actually can't really find the right size, like, you can actually purchase covers for pull-up pads. And they look like actually literally a set of knickers that will be put on top of the normal pull-up, like, so that actually everything is in place. Well, that's maybe good to know for the people in the chat that
Okay, so it's kind of keeps it
exists.
contained, so to speak, and holds it in place.
Yes. Yeah, yeah.
That's really helpful. Thank you very much. And I think I'd like to move on and talk about actually when is the right time to seek medical advice. Because when we're dealing with somebody living with dementia, it is a complex brain disorder. Sometimes things come and go, sometimes things, get better, sometimes they don't. And sometimes it can be really hard to judge actually, do I need to reach out and find some support? So I'd really like to just talk to you, Charlie, about actually what is the right time? When would you be saying to carers actually now's the time to seek some medical support and advice? What should they be looking for?
Well, I think the first thing is if what's happening with the incontinence is having an impact on somebody's quality of life, both yours and the person you're caring for, that is a sign. And for me personally, if people came in and said there was a problem with incontinence, I was delighted, because it meant that they had got above that. I'm just going to hide away and keep this to myself, and they were actually asking for help. And like with most medical symptoms, if you present early, it's easier to sort things out. So have a
Yeah.
low threshold for contacting help, for getting help. And actually what we do as GPs is see what the situation is. Has there been a sudden change in anything? Is there any pain or discomfort associated with it? What are the bowels doing? Is there any blood rectally, blood in the wee? Is there what's happening on the medication front? Are there medications that could be causing this? What about diuretics? They were started 15 years ago for blood pressure or something like that, and they're still going. Nobody's stopped them. So there's a whole range of things that we would do, and examining the patient, checking what the bowel's like, doing urine samples, those kinds of things. And so we go through this sort of profile as to what's going on. And then actually we may find that there's a problem, water infections or whatever. But we've also got the wonderful continence teams, which are brilliant. And they've got such an experience and such a wealth of knowledge that we can sort of check to make sure, well, what's happening with the prostate and all that kind of stuff. We can do all that, but then we've also got the continence teams as well, who can give us so much advice for dealing with the symptoms of, if you like, straightforward incontinence, or even the incontinence caused by medical things going on. But it's
Yeah.
definitely worth saying, please help, and having a low threshold for contacting.
And I think it's really fair to say at this point that actually things like UTIs, water infections, can have a huge impact on cognitive decline as well. I think often what we hear is people sort of go, oh gosh, they're really declining very quickly, and there's lots going on, and actually they don't behave like this normally. But actually, that can also be a sign of UTI, can't it? And things.
That can be that can be just the only presenting feature of a UTI, and
Yeah.
can be quite devastating. Yeah.
Yeah, absolutely. And also dehydration will
Mm.
impact that cognitive ability. So, it's kind of all wrapped into one. We know it's a really huge topic, and I guess we could probably spend all day talking about this. But again, I think it is just reiterating actually, if you're seeing any changes, strong smell of urine can be a sign there's something going on. If you have that concern, it's always better to have that conversation than not. Nina, what can carers expect if they do reach out to someone like yourself as an Admiral nurse or a GP?
I mean, one of the most important things I think is really that you 100% can expect like that you have someone either on the phone or in person, someone that is supportive. It's definitely a confidential discussion. Like, if someone is talking, like one of my families is talking to me, it is as confidential as if, they would talk to Charlie as a GP, for example. And
Yeah.
so nothing like, so everyone can feel safe, and, we are able to give advice. And what I can actually promise everyone, like, because I do not know everything, but like all my colleagues and me, whatever we don't know, we get the information for you. Like, so it's just basically you can see as a bit of like, like a helping hand, or like a wing woman and a wingman, basically, to
Yeah,
help
I think
you
it's
and
one
get.
of those subjects, isn't it? When people reach out, it's one of those actually, oh, I'm glad I did that. Whenever I've worked with
Yeah.
caregivers and they've said, I really put it off, and I don't know why I put it off, because actually the support and the help was great. And
Mm.
it can make such a huge difference to both you as a caregiver and the person you're supporting, that quality of life, that dignity, that fear of going out, and what to do. It can make such a difference by seeking that support early, can't it? And having that early intervention absolutely improves those outcomes that we can expect to see. So I think really, the ultimate message across this is there's lots of things we can do to support people with dementia if continence does become a problem. But I think it's really about acknowledging that actually it is opening up that conversation and seeking that support. Making small changes can make all of the difference. Is there any final notes or any final pieces of advice that either of you would give before we wrap today's session up? Charlie, I'll come to you first.
Yes, I think I'm back in Sainsbury's. And that if you look around Sainsbury's, you can bet your bottom dollar that there'll be many people in that supermarket at the same time as you who are suffering from incontinence. The problem is that a lot of them won't have said anything to anybody about it, and they'll be very isolated. Getting out there and asking for help is the way forward. There's no shame, there's no negativity. This is a symptom as any other medical symptom, and it just needs to be exposed. And then there's really a lot of really good help out there. So just come forward and say, please help me.
Thanks, Charlie. And Nina, anything further to add to that?
I mean, that was already perfect what Charlie said, because and it's true, like, it was perfect. And the more we talk about it, the more, even though it is completely normal, but the more normal it will get. Like, if
Yeah,
we all talk about it.
yeah, absolutely.
Brilliant. Thank you. I think today's been a really important message, and I hope that it's been really helpful for any of you who have joined. So I will wrap up today's session and just really reiterate that actually you're not alone on this journey. This is something that we see within the dementia field many, many times, time and time again, but there is help out there. So do reach out and seek that. At the end of today's session, we will get the resources out to you. There is various links we can share with you that we will do and direct you to support. But again, just reaching out to your local GP surgery is a brilliant start point. So it's really for me to say thank you ever so much for joining us today. We will see you again on next month's session, but look after yourselves and remember you're doing a brilliant job. Thank you.